going on. See you back here at 6:30.
All right, Tom, thank you. Next in News for Your Health, why so many women get asthma after menopause.
And for eyes that have been injured, an artificial part that can keep you from becoming legally blind.
And speaking of eye problems, imagine sustaining an eye injury so serious, doctors are hard-pressed just to save the eye. But the eye is so complex that missing something as seemingly simple as the iris, the colored part, can be disabling. This is just such a story and the amazing surgery that restored one man's vision. It's near perfect days like this one that Jeff Pollastrini lives for. That's him catching a wave off the north shore of Kauai in the Hawaiian Islands. He was just about to call it a day after some great rides, floating calmly in the water, when his surfboard crashed into his right eye.
I never saw it, and couldn't see immediately. I couldn't see, and then what I could see was yellow and blue spots, you know, hazy, and I came up out of the water and I touched my eye and there was blood on my hand, and I started praying immediately.
It was even worse than he feared. Jeff's eye had literally exploded on impact. Over the next 3 months, he had multiple eye operations, including repair of a retinal detachment and a cornea transplant. It saved his eye, but not much else.
From distance from me to you, all I could see would be your suit color, color of your head. That was about it. No facial features or anything.
The problem was that both the internal lens and the iris had been blown out of Jeff's eye in the initial impact.
The iris serves a very important function, and that is to regulate the amount of light coming into the eye and to adjust according to the amount of light, that comes into the eye.
Meaning that most of the time, Jeff had to squint against the tropical sun.
I compared it to somebody, you know, putting a laser beam into your eye.
But then Jeff heard about Dr. Ken Rosenthal, who was doing an FDA trial on an artificial iris. They come in various types and colors. Jeff's was a combination iris and lens. It was inserted this past October in an operation similar to a lens implant after cataract removal.
They don't open and close like the normal pupil, but we've established that about a 4 to 6 millimeter pupil, depending on the patient, is adequate for most lighting circumstances.
Today, Jeff's back surfing, but more amazing is he can now see 20/40 out of his injured eye, good enough to pass a driver's test without glasses.
By the first week, I'd already forgotten that I was blind in my right eye. It was amazing.
Yeah, it truly is. Dr. Rosenthal says the results so far have been excellent at reducing glare and light sensitivity with the artificial iris, which helps people who've suffered trauma to the iris after eye surgery or other blunt injury to the eye, and for certain congenital eye problems. And by the way, Jeff was injured at the same beach where that young woman lost her arm to a shark attack. Some bad karma on that beach, I think.
He should stay away from there.
But is he surfing again?
He's back surfing. He can
So
drive.
is the young girl,
he can see fine, and his eye color almost matches. He's doing pretty well.
All right, Dr. Max, thank you.
You bet.
That's Live at 5. Thanks for joining us.
Here are Chuck Scarborough and Linda Beccaro with News Channel 4 at 6. Good night.
You're watching NBC for New York. And now, Chuck Scarborough, Linda